I will start my talk with incidence and epidemiology. I searched PubMed and there were 586 with thoracolumbar trauma and incidence and 387 with thoracolumbar trauma and epidemiology. One of the best epidemiologic studies is coming from Sweden. It was 13,496 admitted patients. Majority were men, and the annual incidence of the fractures has been found 30 per 100,000 inhabitants. If they look, but they did not differentiate osteoporotic fractures from with non-osteoporotic fractures. So the incidence, if it is less than 60 years, is quite less, 13 per 100,000. Incidence did not change considerably during the study period. But then they have used this sentence: the crude annual number of patients admitted decreased slightly over the study years. Probably it is not very significant. Surgery was applied in 15% of the patients. If they look at more than 60 years patients, older patients, the operation proportion is quite less, 2%. And at the end, they say we could not extract if the patient has osteoporosis. Another study from Finland. This study is telling that the mortality rate of spine injuries are decreasing. This is again a very large study. And they comment that the addition of seat belts and airbags has created a different environment for automotive trauma, and the mortality rates are decreasing. The low energy injury deaths involving older patients happened over a longer period of time, presumably from complications associated with the injury. And they say that the aging population is clearly demonstrated that the death rates over the course of the study is probably increasing. Older men have a disproportionate increase in death from spine injuries in comparison to female patients. They have speculated that why it is gender specific. The men are less likely to accept the changes of age, and then they tend to fall in front, and then it causes spine injuries very often. One study from Canada and USA, retrospective review of data, 390 patients with thoracic and lumbar fractures. This is not a good epidemiologic study, and then they say that operative treatment was about 70%, and neurologic deficit were in 36% of the patients. Another study from USA, from Los Angeles only, level 1 trauma center, 13-year period, 1996 to 2008. Among all trauma patients, 5.8% suffered spinal fractures. And those are having 21% spinal cord injury, and motor vehicle accidents were the majority of them. The mortality rate due to spinal injury decreased significantly, as have been found by Swedish study. The incidence rate of spinal cord injury also decreased over the years. It was 23% in 1996, but now it is 6.7% in 2008. And they conclude that the spinal injuries are increasing with age, especially blunt spinal cord injury and injuries at multiple spinal levels. And the biggest conclusion of that study is the mortality rate of spinal injuries are decreasing by the years. They have concluded, other than reduction in mortality, reduction in spinal cord injury due to motor vehicle accidents, and elderly population is more likely to suffer spinal cord injuries by the coming years, the recent years. But this is from the proceedings in 2018, a 10-year period in the United States. Incidents, they were looking only to lumbar spine fractures, and the incidence of lumbar spinal fractures are increasing. But this is because of osteoporotic fractures. And the majority between ages 80 to 89, and more often in females. We can expect it nicely because by the increasing age of the populations, we are seeing more and more osteoporotic fractures. A German study in 2010, in a 2 years interval, looking at the operative treatment of 733 patients with acute thoracolumbar spine fractures. The main reason was fall from height. Most of the cases were at T11, L2 levels. And they have applied AO-Mager classification. And the paper is focused on a surgical approach, not epidemiology mostly. One another German study, 2009, retrospective analysis, level 1 trauma centers, and the most common cause of accident was high energy fall than the traffic accidents for thoracolumbar injury. But if you look at all spine injuries, the highest reason, the biggest reason is motor vehicle accidents. This is a pediatric and adolescent patient group, 546 patients. Fall from height is the main reason. They stress one different thing, that the multiple fractures are common in adolescent and pediatric ages, almost 53.2%. Very small amount of them needed surgery. And they conclude that vertebral fractures in children are usually multiple and should lead to broad diagnostic coverage. We must suspect other injuries in a child if there is one injury. A Chinese study, a very large group from 24 rural countries in China, 8 provinces. The incidence rate has been found similar to that Swedish study, 32 per 100,000 people. Among all age groups, fractures of thoracolumbar spine were the most common, followed by fractures of L3, L5. A small study from Saudi Arabia focused more on the surgical treatment and saying that 33% of the thoracolumbar fractures have been managed surgically. A Cambodia study, 277 patients, retrospective review. They have got very minor resources. They have done surgical costs between $100 and $280, very, very cheap. Mean age was 40. They have collected all trauma, then thoracolumbar trauma was the most common. Motor vehicle accidents was most by motorcyclists. as we are expecting. They actually, in the developing countries, they were using more bicycles. Now they are using more motorcycles. So then they don't use helmets, and then they don't obey the traffic rules. So most of the trauma are coming from motorcycles. Falls from palm and mango trees is the second reason. And this is all. This is not a real epidemiologic study, but it can give us a mirror of what's happening in the developing countries. A meta-analysis from 2016, they have looked at 21 articles, and the rate of thoracolumbar fracture in blunt trauma has been found 6.9%. Spinal cord injury was 26%, and associated injuries were as follows. We don't care much. Another meta-analysis, 2016, flexion destruction injuries showed an intra-abdominal injury rate of 38, and the most common vertebra injured was L1. Etiology was mostly motor vehicle collision, then high energy fall, but it's 36, then 31. Actually, we can change those statements, but I created those statements. Mortality rate to spine injury is tending to decrease. This is more with motor vehicle accidents due to the improvements in motor vehicle safety and traffic regulations. Please make comments, or let's discuss that statement. This is the first statement.
Because maybe if you take Europe or US, this could be the case, but maybe in countries in Asia where development and still increase of the cars and the law enforcement is not very.
Actually, there were two big studies, one from US, one from Sweden and Finland, telling that the mortality rate is decreasing. But there is no such study in the developing countries, right?
Maybe we can say that mortality rate is on the decrease. Mortality rate is decreasing in developing countries. Mortality rate due to spinal injuries decreasing. It's tending to decrease. We need, spinal after spinal injury.
Right.
He can quickly do this. Yeah. After spinal injury is decreasing, tending to, we can delete, is decreasing in developing countries. Imad, you have to help here.
In developed countries.
Developed countries, yeah. Sorry. Sure.
Dr. Mehmet.
Yeah.
We are working in a developing country, and also our catchment area is from the rural area, and the peoples are under the below poverty level. So actually, what we see, because of the poverty, they cannot continue the treatment of the bed sores. I have only observed this is the area of thoracic lumbar which has the least likely lethal injury, or the mortality is less on the basis of the site of the injury. But what happens in the developing countries with the poverty, then most of the young people, even when they go to their villages, they even don't take care of their urinary catheters, and even when they come back and follow up, they have the very large bed sores. And that is the reason, the poverty is the main thing, which is a reason of the mortality of thoracolumbar fractures in our setup, which I wanted to add.
Okay, we were
We are
meaning
not
that.
discussing that. We're just discussing this point at this time. So we take one point at a time. Otherwise, then there's lots to discuss.
Yeah.
Otherwise, we won't finish.
Let's now
Just
vote
focus
this.
on this one point.
First statement.
This is more with motor vehicle accidents due to improvement in motor vehicles. So this statement is fine because we're only talking about developed countries.
We are voting.
Okay, let's vote.
After voting, shall we
can see them over here.
Shall we next? Shall we push to next? Imad?
Yes, sir. You have to vote all the statements.
No. Just one. Only the first.
Just go down. You don't have to say next. Just go to statement 2.
Okay. The incidence of low velocity falls are increasing, especially in elderly population. Low velocity fall is any, yeah,
factors, basically.
yes, especially in elderly population.
So we can say the incidence of low velocity falls leading to osteoporotic fractures.
Shall we differentiate that? Actually, most of the papers did not tell that, because they are saying we cannot differentiate whether it is osteoporotic or not.
Okay.
We could not, they say.
Okay.
Second,
Let's vote for second.
third, the mortality rate among male elderly patients are relatively high. This was a good epidemiological study. Yes.
There's only one study that's shown that, or every study has shown that?
There is, actually, I can show you that. Where is page up? This is that one from Finland. Finnish nationwide register-based epidemiology study on data from 1987 to 2010.
Okay. Okay, good.
Actually, they are, those countries are collecting all people's data. It's quite amazing. They can even give the names of all people.
Okay, I think let's vote on this. It's fine.
Yeah. Four, the most common cause of thoracolumbar fractures are falls and traffic accidents. Sorry, I've done a mistake. In some studies, the leading cause is falls, in some others traffic accidents. I didn't want to differentiate it.
It's fine. It's a good statement.
Fifth, the real incidences and epidemiology in developing countries are not well known. I could not find any good study.
Do you want to suggest that World Federation should help the developing countries to collect this epidemiology and incidents?
This may be written in the comments of the papers, I think. The annual incidence of thoracolumbar fractures is about 30 per 100,000 inhabitants. I have taken this from Chinese study and US study and Swedish study, sorry. If osteoporotic fractures are counted together, the incidence in older populations should be considered higher and increasing in the last decade. Actually, we have talk about that, the incidence in the elderly patients is increasing on the second statement.
We have already voted on that.
Yeah.
So
We can,
delete that.
if you wish, we can delete this part.
Yeah. Again, that the incidence that we are quoting is from a country.
Yeah. The annual
This is,
incidence.
and we don't know others. So, should we specify?
But the China, do you think it should be considered as?
They are both. They're developed and developing as well.
Yeah. So then,
Let's vote on it. It's fine.
yes, just vote on it. And this 7, vertebral fractures in children are usually multiple.